Hello.
Hi, Laura. How are
How you
you?
doing?
Good.
Good.
We just got a few people on
Perfect.
already, so we're just so in lieu of Dr. AJ, obviously I'll mention that she's ill. Um,
Yep.
and then yeah, I'll just, transfer it over at the usual spot
Okay.
and and that should work well.
Okay. That's great. And you'll be able to just advance the slides and everything like we did before.
I will.
Great.
Absolutely. Yeah, 100%.
So I'm just going to actually turn my camera off here just for a second.
No
And
problem.
I wanted to join in with lots of time here, but I just need to step away for a moment and I will be right back.
No problem at all.
Okay. Nothing else you need from me?
Nothing at all.
Okay. Also, our new, just as an aside, that new Club Z member I was telling you about had actually seen the replay of the old webinar of mine. That was how, so she did come to us through the webinar that I did with you ages ago, and then found us online. Anyway, it happened.
That's fantastic.
Yeah.
That's fantastic.
Okay, be back in a sec.
Okay. We just have a question from um, the panel. If you can see the slideshow right now, I think you're seeing everything that you should be seeing at this point because um, the guests on the webinar are usually not shown in the side panel. So I hope that makes sense. Like, for example, your picture won't show up, but if you're seeing the screen and you're hearing me, it means that everything is working just as we would hope. Okay, but welcome everyone. We've got about just under 5 minutes before we're going to start. We just want to give a few more people time to log in. The official start time is noon Eastern, and we have many that log in after the fact, so this is being recorded as well, and you'll be sent that recording whether you're here live or if you're joining us after the fact. So we'll just give it a few more minutes, and then we'll be able to kick off here. And thanks for joining us today. For those of you that are just coming in, we're just waiting a couple more minutes. We'll start pretty much right on time at noon Eastern. And this is being recorded, so certainly for those of you that are keying in at your convenience, we appreciate you viewing this as well. And so just a couple more minutes and we'll be starting off here. Thanks for your patience. Okay, I think we should get started. So thanks everyone again for joining us here today. As I mentioned, for those of you that are reviewing this at your convenience, we appreciate you taking the time as well. And certainly any questions that you have, as you won't be here to participate in the Q&A at the end, we're very happy to share that. If you just want to drop us an email, we can certainly take it from there with you. So today we're going to be talking about a wonderful project that was initiated last year that's been really so inspiring for, I think, all of the team members that have collaborated on it, in addition to the communities that this has been impacting, called Get Up and Go Nova Scotia. And really, the whole idea behind this project was to empower patients and promote health through the use of the Activator and urban polling programs. But what I really love about this is, in order for us to make a difference, it was truly a collaborative effort between an amazing family doctor that I'll talk to you about in a moment. Laura Lundquist, who is the other speaker featured here. She's a phenomenal physical therapist and really leader in the Canadian physical therapy industry. So very, very lucky to have Laura here with us today, as well as my amazing team who were involved in this. So just very quickly, my name is Deanna Oliver, and I'm the owner of Urban Polling, and I'm very happy to be facilitating with you here today. Laura is going to be introduced at greater length a little bit further down in the presentation. But as I said, Laura is an incredible physical therapist. She is the founder of Zoomers Physiotherapy and Health Solutions and Spring Physiotherapy, as well as the Club Z fitness program, which is a virtual online program that you can participate in no matter where you are in the world. So, you know, if you have patients or clients that you feel would be interested in virtual opportunities, you should really check out the Club Z fitness program because it's truly phenomenal. And Dr. AJ, as we call her, Dr. AJ is the one that really is the reason we're here. She spearheaded this entire initiative. She was the one that applied for a grant through the Family Doctors of Nova Scotia. And it's unfortunate that Dr. AJ is under the weather, as so many of us are, because she was meant to be here live today. And unfortunately, she couldn't participate. But what we have is some wonderful videos of Dr. AJ speaking about her involvement in the project. And so in the absence of her being here, which she was, you know, very upset not to be able to be, at least we have that. And certainly any questions that you have, you know, specific for Dr. AJ, we can always take back to her. And I know for sure she'll provide some nice responses. Okay, but hopefully we can cover all that off today. So really, the idea behind today's webinar is to give you an overview of what we did. This was many, many months in the making and still evolving, to be honest with you, still rolling out in Nova Scotia. But the idea is that this Get Up and Go could be Get Up and Go really anywhere. in the world. And so while you may see things here that are very specific to Nova Scotia, as they well should be, think about it from the context of where you are in the world and how this may actually be something that you could potentially implement. And so just to review, we're going to talk just a little bit about Urban Polling, the company. For those of you that may or may not know, what is it and some of the key benefits? We're going to go through some of the unique features and benefits of the Activator and Urban Polling polls that are exclusive to our company. And then we'll get into how Get Up and Go all started, the collaborative effort, and then how you can think about getting started in your own practice, emulating the resources that we've already developed for this project. And so just very briefly, Urban Polling has been around for nearly 20 years. It is a woman-owned company, and we are expanding in various parts of the world, which is very exciting. And certainly if you have interest from your region, we'd love to hear from you. So please do feel free to reach out. What I love about this company is that as we are so focused on the excellence in our product, as much as that, we are focused on education. Education for physical therapists like Laura, for wellness professionals, for nurses, for doctors. Many, many different practitioners have taken part in our training over the years. And we spend as much time within this space as we do on ensuring that our products are truly the best that we can offer in the world. And so just a very brief review, what is urban polling? Urban polling is essentially combining walking with specialized polls. And the whole idea is that, especially in the format that our company is a proponent of, there's really two different styles of polls and corresponding techniques. And the lady in orange there that you see is doing more of the active proposition. So she has the black bottoms and that orangey sort of tank top blonde hair there. And she's using the poles on the angle. She's basically very healthy and fit, and she's using the poles to give herself a nice push forward. So a little bit more of a fitness proposition from that perspective. It's all fitness because it's all walking and movement, but she's going to have a little bit more of a metabolic boost because of the fact that she's using the poles on the angle and they're designed to push her forward. For those people that we don't want to push because perhaps their balance is compromised for one reason or another, or they're having severe orthopedic issues that requires more offloading, that's where the activator really comes into play and the activator technique. And so two very different propositions, but the whole idea is you're combining specialized poles with walking. And through that, you're getting not only a combination of aerobic and strength training, but with that, a whole myriad of benefits because of the fact that you're using nearly 90% of your body's muscles just by adding the poles. So there's lots and lots of evidence around this. There's actually over 350 published studies now on this for just about every chronic condition under the sun. Again, based on those two key factors, you're getting aerobic and anaerobic benefit through one specific form of activity, but across many different areas, neurologic being one, as well as for orthopedics, this is being used quite regularly, and then just in general for healthy aging, to be able to boost your metabolic benefit. You burn a minimum of 20% more calories just by adding the poles. You're getting about 1,800 abdominal contractions per mile or about 1,000 abdominal contractions per kilometer. So lots and lots of benefits with respect to this form of activity. And that's why we are really seeing and have been in Canada for many years, and now in the US and different parts of the world, really these kinds of power groups coming together where it's teams, health teams that are embracing this and recommending it to their patients through a more collaborative effort based on so many of the benefits that you're seeing on your slide here right now. And so now just diving into the Get Up and Go program, really, as I said, Get Up and Go is about empowering patients and promoting health through the use of these poles. And that's what we're here to share with you today. Now, I'm just, as I mentioned, Dr. AJ, for those of you that didn't join immediately, she is under the weather. And so we do have this video of her speaking about a little bit more of the background about how this got started. So I'm just going to play this for you now.
I'm Dr. Jaya Bharathan. Most people just call me Dr. AJ. I'm a family doctor and I've practiced here in Halifax, Nova Scotia for 33 years. Nordic walking wasn't something I was very familiar with until a patient of mine literally walked in with his poles. He explained to me that he depended on them for his mobility, his stability, for exercise, and I watched how quickly he recovered after a really bad knee injury. And after that, I decided I needed to learn more about Nordic walking and the use of different poles. I started to see a lot of benefit to patients in my primary care practice with the use of Nordic walking and the poles. So whether it was diabetes and needing to lose weight around the middle, whether it was activating your core, whether it was balance, it seemed to really fit different patient populations. So people with diabetes, cardiovascular disease, Parkinson's, multiple sclerosis. And as I started to tell patients about it and as they were using it, I could see the benefits, and so I kept recommending them. There's many different types of patients that will benefit from Nordic walking. Honestly, anybody, and it doesn't matter what age you are. It just helps you with activating your core, improving your mobility. It helps you burn more calories. You're using 40% more of your muscles when you literally walk with the poles rather than just walking. So whether it's a walking program, whether you have a disease condition, it fits anybody and everybody. So I find sometimes patients are uncertain about whether they could coordinate themselves with Nordic walking. And I've been able to address that with the help of our partnership with Zoomers and Laura Lundquist and her team. So we have physiotherapists that are very excited and interested in guiding patients and also assessing which type of pole is appropriate for them. The type of poles that a patient needs does depend on what they're going to use it for and their own health conditions. So for a lot of patients, the Urban 300 series is a good fit if they want to go walk with them. But other patients who might have challenges with their stability might need the Activator poles. So I always use the assessment that is done by physiotherapists to determine which is the proper pole for them, just to make sure that those with stability challenges are given the right poles. After I noticed the benefits that my patients were seeing, I decided I would try them as well. So I started to use them every day on my walks, and I had the same benefits that patients were seeing. And much to my delight, I ended up with a vestibular problem, and my balance was off, my coordination was off, but there was so much muscle memory that I had built up through the daily use of the poles that I could still walk using them while my vestibular system was healing. So in the summertime, I tend to walk all around my home. There's a lovely trail there. And in fact, in the wintertime, I do use the same path because, of course, the boots come off and you've got the picks. So on days where there's not too much ice on the roads, which we have in Nova Scotia, I usually use them year round. Well, my body is aging, as all of us are, but there's something magical about these poles. When you put them on and you start walking, actually, my dad said it was like swimming through air, and I must say that's the experience I have. And that activation of your muscles is something tangible. You feel it at the time, and you find yourself sitting up a little straighter. You find yourself holding yourself differently because of that activation. So I continue to enjoy that every day. We are very excited about the Get Up and Go Nova Scotia pilot. This was made possible by a grant from the Family Doctor Council at Doctors Nova Scotia, and it allowed us to purchase a number of poles, and it allowed us to collaborate with Zoomers Health Solutions and Urban Polling, the company, so that patients can have a complimentary session where the physiotherapist does the assessment, and depending on which poles they need, we're giving it to them free of charge. And this has been exciting, very exciting. And our hope is that after the pilot, we will have worked out different aspects of what we need to do to go forward and really introduce it to the entire province. So maybe in 5 years' time, you're going to see a whole lot more of the use of these poles by people of all ages.
So while it doesn't replace Dr. AJ being here live, I think it was a
I'm
wonderful
Dr. J.
of everything that she certainly spearheaded here with this project. So just to say, and very briefly, for those of you that don't know, our polls were designed through the lens of an occupational therapist and gerontologist, so very different features and benefits from what you'll find from the typical walking poles. One of the key differentiators is the ergonomic handles, which we'll touch on more in a moment. But with respect to the Activator poles, the button lock system is critical for ease of setup, especially with arthritic hands, and also to ensure that once that button lock is in place, it's not collapsing. And that's really, really important because a lot of poles that are on a twist mechanism, especially where offloading is required, so your client is actually really needing to push into them, will collapse. And so with these, you're not going to get that. And there's a real safety and confidence actually that the patient and the client feels when they're using these because they know they actually can rely on them. The bell-shaped tip is available for additional offloading and stability. It's that wider sort of surface area that again is allowing you to really be able to lay into them, and that supports balance as well. And it's real rubber, so it's a distinction that we have to make because there's other poles where there's more plastic involved in the manufacturing, and when that happens, it cheapens the quality of the product, but also really importantly, it reduces the amount of absorption, the shock absorption. The rubber will actually do that when it's hitting the ground. The plastic will not, and the plastic is jarring through the body. So quality matters when you're recommending your clients and patients. The carbide steel tip is available on all of the poles. This is often some confusion. Sometimes things are sold separately. It's right with the pole. So you remove the bell-shaped tip, and that is when the carbide steel tip is revealed. And that's more appropriate for different terrain. So things like sand and gravel and snow and ice and trails where there might be a mix, where you may feel like that may be a more appropriate and suitable traction tip to be using. And really just the anti-vibration features, which all really begin through, as I mentioned, the core grip handles and that wonderful ledge that we've provided, all support the fact that this is meant to be the best user experience for your patients. So where are these poles more typically used? It's more around supporting balance and improved posture, taking pressure off painful joints, gait retraining, and acute rehabilitation. And top forms of prescription typically are pre-post orthopedic surgery, supporting neurologic conditions where gait has been impacted, and then just for older adults as well. Just very quickly on the urban poles, you see, again, the ergonomic core grip handle, which is on all of our products, really is the difference maker. It's strapless by design to reduce the risk of injury. And that ledge is really what promotes, first off, comfort. So approved by the Arthritis Foundation, better for people living with arthritis versus other poles and products, but also for core activation. And then the carbide steel tip still included on the urban poles, the anti-vibration features, and the rubber tips positioned differently, as you saw, supporting the different technique of the urban poles, where you're given a little push forward, hence the angle of the boot tips. So those are just some differences in the product lines that we offer. And generally speaking, as mentioned before, when you're looking for, well, which one is suitable for my client or patient, the Activator supports more balance and offloading, whereas the traditional Nordic walking urban poling technique is more for active individuals across many different conditions and need states, but really, and could also be a progression from the Activator technique itself. Before I introduce our next guest speaker, I just want to provide again, because Dr. AJ was not here today, just a little bit of an interview that was done at the time the project was initiated between Laura Lundquist, the physical therapist involved, as mentioned, and Dr. AJ.
Let's start with just how this all got started.
So it was a few years ago, and a patient of mine walked in with these two poles, and I had not seen that before. My patient was elderly. I'm used to people coming in walkers. However, he was limping because he had a knee injury, but he was holding himself upright and walking with much greater ease than I've seen most of my patients. So I was curious, I asked him about it, and I learned that he was using these poles to do what's called Nordic walking. And to my surprise, he did a lot better than most of my patients do with an injury like what he had. In fact, he went on this long pilgrimage, which I didn't think was even possible, but he did it because of these poles.
Wow.
So that kind of got me curious. I looked into it a little bit more and discovered that, yes, there is a lot of value to using Nordic walking and using the poles to activate muscles, to create new muscle memory, and many, many other benefits. So it was fantastic.
Absolutely. I have found similar in my practice, and I came to know more about walking poles because my patients kept asking me about them. And I realized, although I'd been working as a physio for 15 years, I really didn't know that much about them. And the more I learned about them and started experimenting with patients, I noticed, just like you say, these amazing benefits in posture and comfort and confidence and walking speed, all kinds of things that really help them get more out of their walks.
And Laura, it's interesting once you learn about something new like that in medical practice. Sometimes you're curious enough to try it yourself. So also to talk to family about it. And my dad happens to have Parkinson's. So that was kind of my next step forward. Because, of course, as you know, with Parkinson's, there's so many things that change your balance, your stiffness, kind of the rigidity. But to my amazement, when he used the poles, there was more fluidity. And so, again, his muscles and balance was built up in a way, as a physician, I had not seen with anybody else with Parkinson's. So once that was done, I must say I got a pair and I started to use them. And I've also been benefiting from them greatly.
Excellent, excellent. And one of the great things that I have found in working with you over the last few years is that because we have this shared recognition of how much value they can bring our patients, we have really worked well together to be able to help patients understand how they can be of benefit to them and be able to use them with good skill and good confidence. How have you find that helpful in your practice?
Laura, I don't think I could have done this without working collaboratively with a physiotherapy team or a physiotherapist like yourself. I think when you're like-minded and you want to share the care of a patient, you find ways by which you can work to the fullest scope that you have. And then you start to create these innovative ways by which you can take it to the next step. And that's what this has felt like, because this whole get up and go pilot is really resting on the shoulders of our collaborative work together. And what I find is, part of my job is informing patients about what Nordic walking can do for them, what the urban poles with the ergonomic handles and just the way that it's set up. Of course, there's the walking poles, there's the activator poles, and then I'm sort of selecting patients for each one of those and for different purposes. But the next step is to then send them to someone like yourself who is trained, who is knowledgeable, who has expertise in it, so that you can determine, which pole is best for them. What are some maybe exercises they can start with? What's the best way to walk? Because just saying to someone, go out and walk, is not always the best. Am I right?
You're absolutely right. And also, it takes skill to learn how to use those poles, right? Some of it comes a little bit naturally because of the natural swing of our arms, but there is a skill to it, and it's important to make sure that the poles are set up properly for you and that you know the technique that works best for you. And I think, as physios, we tend to have often more time with our patients than maybe the family physician does. So I think what's been great is that you've been able to recognize who might benefit from a set of poles and why, send that information along to us, and then we help them get set up, like you said, with the pole that's right for them. And we've got the time to spend with them, setting them up properly and practicing the skill, because you can get so much out of it, but you do have to be proficient at the use, and that takes some learning.
Absolutely. And it is incredibly gratifying to then sort of see them come back after having done this work and then see the benefits that they have. And then we start to reinforce them with, maybe more exercises or a different way of being. But really, it helps to sustain somebody to keep using the poles, because I think there's different exercises people will do for a certain period of time, and then maybe the seasons change. And they're not going to be doing those anymore. So as a family doctor, that's one of the questions I'm constantly asking is, what do you have planned for the winter? Because we all start to sort of not move a whole lot in the wintertime. So with these poles, of course, you can use them year round, which has been fantastic. And like I say, that, the buildup of the muscle memory, and also for the patient, the excitement and the feeling of what it is like to have their body activated has been just remarkable.
Yeah, for sure, for sure.
Good. And with that, I will introduce Laura officially now. I'll let Laura talk a little bit about herself here, and then I'll be advancing the slides for Laura.
Great. Thanks so much, Deanna. Hi, everyone. Thank you for your attention so far. And and I'm hopeful here that I can bring you a little more detail sort of around the edges, and then be able to answer any questions you have about possibly implementing something similar in your practice, wherever you may be. As Deanna mentioned earlier on, I am a physiotherapist based here in Halifax, Nova Scotia, Canada. I do own a couple of physiotherapy clinics, and also this Club Z Fitness program, which we'll talk a little bit about because it does have some relevance to how you might choose to implement your use of walking poles in your practice. My real passion, my background as a physio before I opened my clinics was working in elite sports medicine. My real passion, though, is helping people continue to stay active and really thrive in their lives and be able to keep doing the things that they love to do. And so that's why I love these polls, because I feel like they just empower our clients to be able to get so much more out of their walks and out of their lives. And so I'm always excited to have an opportunity to talk about them. So let's dive into it. I'm just going to recap what was shared there earlier on. So this Get Up and Go Nova Scotia pilot program, which is now finished, and we've just moved into kind of Get Up and Go Nova Scotia, full stop or full go, but did start off as a pilot program with this grant money. And really, again, the team of primary care providers, which was spearheaded by Dr. AJ, but we actually had 6 or 7 physicians around the Halifax area who were able to identify patients of theirs who they felt would benefit from the polls. They would send off a referral directly to my physiotherapy clinics with the patient's information and why a set of polls might be beneficial for them. And then we would set up an appointment for them to come in with one of our physiotherapists here who's been trained in the use of the Urban Series polls and the Activator polls in order to be able to fit the patient with the right set of polls for them, and also give them a lesson on the proper use of them so that they could get the most out of them and feel confident with them. I don't know if you've had any experience with people with polls, but I often, when I'm just treating patients for whatever condition, I'll ask them, what kind of activities are you doing? And if they talk about a walking program, I will ask them if they've incorporated the use of poles. And more often than not, I hear someone who's a pretty avid walker will say, "Oh yeah, I bought a set and they're in a corner, but I wasn't quite sure what to do with them. It seemed like a good idea at the time, but I wasn't sure what to do with them." And so what we want to do is make sure that people know what to do with them and feel confident to use them and get all the benefits that they provide to them. So through this grant that we received, we were able to purchase a number of set of polls with great collaboration from the folks at Urban Polling. So we were able to distribute 38 sets of polls directly to these patients who really stood to benefit from them with a variety of conditions. And we'll hear from Debbie here now, and she'll tell you about her experience getting a set of polls through the program.
Debbie Saunier, and I live in Eastern Passage, Nova Scotia. I find that these polls they've really helped me, and if you got pain and stuff and you don't want to walk, this gives you that little bit more stability and support. Well, Dr. AJ really promoted these to me, and she told me where to get them and everything, and then I came back here and I was shown how to use them, set them up, so that was beneficial. I try to use them on a daily basis, usually for 30 minutes, sometimes up to an hour. I was having a lot of trouble with my knees. I had to get a knee replacement, so these helped me with my mobility again. I'm quite pleased with them. I've had people even stop me on the street and say, "What exactly do these poles do for you?" And I said, "Well, they take the pressure off my knees and they allow me to get out there." Debbie.
Awesome. So Debbie, again, just one example of those 38 people that were able to get polls. And we, we had people, Debbie mentioned her knees, so osteoarthritis. Certainly we had folks with balance issues, but we had people who were using the urban polls to help with blood sugar control, with weight control, with stability, with underlying neurological conditions. So all kinds of different people through our patient and client populations that could benefit from them. And we really saw that across the pilot, which was exciting because it means that it's, this one knowledge about this one particular kind of tool just really has so much broad application. And so then it becomes easier to implement in a practice because it's something you can keep top of mind as always, is this a good idea for this patient or client in front of me? And more often than not, the answer is going to be yes. So then the question is, well, how do we actually implement, right? So we've done a lot of work after we went through this pilot and realized, there really is something to this kind of collaboration between primary care physicians, nurse practitioners, sort of that frontline contact, and then other allied health providers in the community. And we've created this sort of roadmap, if you will, of steps that if you're sitting there, hopefully thinking, this sounds like a good idea, but I'm not exactly sure how I could make it work for me and my practice. We wanted to make a roadmap for you so that we could help take demystify some of those steps. So step one, learn how. So it's important to obviously understand how these polls can help. So you're already partway down that pathway being here with us today and getting a little bit of this basic information. And so then once you've got a sense of how these polls can help your patients, then it's important for all of us working in healthcare, of course, to be mindful of the evidence behind anything that we're suggesting and implementing with our patients. And as Deanna mentioned, there's lots of great research supporting the use of these polls with our patients. And so there's access to lots of information through the Urban Polling website around the different research studies in the different patient populations. The next thing that's going to be important is connecting with local retailers, and I'm going to talk about that in a little bit more detail so that people know where to go. And next would be, again, having a connection to local allied healthcare providers. And again, we'll talk a little bit more in detail about that in a moment. And then really the last step is starting the conversation, right? So making sure that your patients are aware that this is a tool out there that could be helpful for them. And then remembering to have the conversation and maybe having a few nudges around your office and other places that can help get those conversations going. I'm going to share with you before I go into some of the tools that we have available for you. We had a physician hop into a smaller version of this presentation that we're giving you today. Geez, off the top of my head, I can't think of how long ago that was, but not long, maybe 3 or 4 months ago. And we just got this message a couple of weeks ago from this physician in Cape Breton, which is just about 4 or 5 hours from where we are in Halifax here, saying that she applied for a grant through the local municipality to be able to purchase some poles, just like we had done through our pilot project for seniors in the community to help them be more active. She got $2,500 through that grant so that she was able to bulk purchase some Activator poles, which was great. She partnered with the Downtown Association in her area to be able to sponsor some guided walks for folks with these poles. And then her running group added a 5-kilometer urban pole walk to the local running half marathon event. And there's really a lot of excitement for the folks who want to participate. So it's really a way to build some momentum. She got some financial support, was able to distribute some poles, help people use those poles by organizing these downtown walks, and then having people have something to build towards by having this event within the local marathon event or half marathon event. So anyway, just a great example of how it is possible, right? Sometimes these things can feel big, but little small steps and finding some community partners along the way can go a long way to making it easier to implement in your community and in your practice. So I mentioned that in order to help you along this roadmap, we have a number of different tools available. There's a digital toolkit through the Urban Polling website that has a number of different things that you can use for your patients. And so I'm just going to walk you through what these are here. First, there's this infographic for roadmaps for implementation. So hopefully you're jazzed up after this and you go out and talk to all the healthcare providers you know. And so sharing with them this roadmap of how they might be able to implement as well is certainly there for you. And just as a reminder of what the steps are for you to think about following if you want to incorporate this into your practice. Then there are a number of one-pagers that really help identify how the different types of polls can help individuals with certain health conditions. And so, I always think when I'm helping clients, particularly with a specific diagnosis, something like Parkinson's or multiple sclerosis or, any sort of significant diagnosis like that, it's really helpful when the content I'm able to provide them from a learning perspective or supporting what I'm suggesting that we do is specific and relevant to the condition that they're diagnosed with. So having these one-pagers to be able to give to someone with Parkinson's for whom you feel activators would be a good tool helps them really feel like it has real sort of relevance for them, I guess, or that it's really kind of built and meant for them, right? And so hopefully that helps them feel a little more inclined to give it a try and to have confidence in what you're suggesting. Next is the activator justification letter. So these letters actually, now there are all kinds of different rules and regulations and policies with companies, but we have had some success here locally with insurers providing some partial reimbursement for the cost of the activator poles because they really are a mobility device. They replace using, in many cases, crutches or cane or a walker. I know Deanna talked about post-operative use of the activators. We see lots of folks here at Zoomers with post total hip and total knee replacement, and anyone who used those poles pre-op, the first thing they ask me is, when can I get off the walker and get back to my poles? So, great for people who have not used them before, but that just tells you how much people recognize the value of using them and how they are a true mobility aid. So you may be able to get some insurance reimbursement for your patients, or they may be able to get some by having you sign this letter. I do see a quick question there, Deanna, just about where the flyers are or the one-pagers are on the website. I think that's pretty easy within the digital toolkit, but maybe if you can just pop an answer into the chat there, and we'll make sure that you know where to find it on the website.
And we're going to share some of these resources in the newsletter that we'll send out following the webinar, so everybody will have a lens on the landing pages we provided.
Perfect. Fantastic. Thank you. Posters. So there's a poster here. Like I said, sometimes the biggest thing is remembering to have the conversation, right? Sometimes our interactions with clients and patients are long and cover a number of things. Sometimes they're really brief. And so it's important to remember to have the conversation. So there's a poster that you can put up in your office that might just help encourage your patients who would be inclined to use some walking poles to ask you about them, and also a visual cue to you to remember to have those conversations. There also is the ability to download prescription pads so that you've got some specific information. You can help people really feel as though this is something that is being prescribed for their mobility, as opposed to just something that you happen to talk about. There are also some social media posts that are there that are available for you to use to help promote the idea that you're using the sort of get up and go philosophy and trying to get folks moving more in your community, more comfortably, more confidently. So hopefully with all of that, you've got your folks interested in getting the poles. Then of course they need to get them. So the question is where, and this is the part that, as Deanna mentioned, is sort of somewhat specific to Nova Scotia and even in some ways the Halifax area. Obviously, there are some local clinics like ourselves that are retailers of the poles. So you may be able, depending on your connections to your allied health partners, they may actually sell the poles on site. Certainly, lots of pharmacies will carry them. So it could be Lawton's, PharmaSafe, Guardian, could be other pharmacies in your area. They are available for direct purchase online through the Urban Polling website or through the Amazon. So really, there are lots of options out there for people. It's just about the option that works best for them. And then this is the part where I'm a little bit more biased, of course, as a physio. So you can get your poles wherever works best for you. But I do really feel, as we mentioned in some of the earlier content, that being fit with it appropriately so that you've got them set up at the right height, and then understanding how to use them properly is really important. So there are a few different ways that you might be able to help your patients do that. And one is sort of the do it yourself, the DIY option, if you will. And so that there's a getting started on the Urban Polling page that helps walk people through setting up their poles and getting going with a walking program. And certainly for some people, that will be a great option. Like I say, there are lots of folks that I have met over the years who have purchased poles, but then stuck them in the corner because they weren't sure how to use them or what to do with them. So sometimes getting started with help is more beneficial than the DIY if you can access the help. And so there's a couple of different options for anybody who's local here in our Halifax area. Certainly at Zoomers, we're happy to do that with folks. Anybody who, one of the things we've done as a practice here is that because we are a retailer, if anyone chooses to buy their poles through us, we will give them 15 minutes of time at no additional cost with one of our physiotherapists who's been trained in fitting and skill or technique with the Activators and the Urban Series poles, so that they can be able to get the most out of their poles and they're sure they get the right ones for them. So that's one option in terms of getting direct help. Obviously, not everybody lives in Halifax. And so the other option that we have here, and that we really piloted through this Get Up and Go Nova Scotia plan, was using our Clubs Ed fitness program. So Deanna mentioned this at the outset, that it's an online virtual exercise program led by our physiotherapists here at Zoomers. And it's a fitness program for strength, balance, and stability, specifically for adults 50 and up. And so what we did was set up a specific class that uses the walking poles for strength, balance, and mobility exercises. And we have a 30-minute free Q&A session with a physio every week as part of being a member of that program. So if somebody buys a set of poles anywhere in the world, they can join Clubs Ed as a member, and then you make use of that Q&A session to get their poles set up properly, feel confident with them, get a quick lesson on using them, and then they can join into any of the fitness classes that we have. And in fact, just this week, I had a message from a woman in Florida who had seen an earlier webinar of mine, found out about the Activator poles, bought a pair, wasn't sure how to use them, and reached out to me, found my email somehow, reached out to me directly, and subsequently has joined Clubs Ed and did her first class today with her walking poles in our Clubs Ed fitness program. So that is certainly, and I think I mentioned there she was from Florida, which is many hours from here. So yeah, so that is there are sort of those different ways of helping people get started with them, feeling confident with them, feeling comfortable with them, either the DIY through the website or locally here in Halifax. Certainly people can come in or using the Clubs Ed Fitness membership option. I've mentioned a few times that our staff here are all educated in the use of the Activators and the Urban Series 300 poles. I cannot emphasize enough how important it is as an allied health professional to get the education on how to prescribe, use, and teach the use of these poles with your patients and clients. I said in that recorded content there that the way that I came to know about poles was because people kept asking me about them, and I didn't know enough about it to answer intelligently. And I mean, I've been a physio for long enough. I could kind of figure out how you might walk with a set of poles. But when I took this course, it really just opened my eyes up in terms of how powerful a tool they were, and some real important technique, tips, tricks, and strategies. And then subsequently, we're a clinic with multiple physios here, and so whenever we bring somebody new on, eventually they end up doing this training, but sometimes it's not immediately. And one of my staff in particular had been with us for a few months, and I had taught her about them. She knew about them, but then after she took the course, her mind was just blown, and she was like, every person who comes in should be using these poles. And so it is so valuable to get that information. And so if you yourself are an allied health professional, I would strongly recommend. Again, this program was really instrumental for us in being able to use them effectively. And if you're a physician or another primary care provider, and you would consider referring somebody to perhaps a community partner you already have, I would suggest that you chat with them about the value of getting this education to be able to ensure that that whole experience for your patients and clients is really complete. So, getting started at your practice, just to recap, using those toolkit resources can really help you stimulate their conversations with your patients, understand who would most benefit from the introduction of the polls. And then if you're not in a scenario yourself where you would have the time to be able to be the retailer and do the fitting in lesson, then make sure that you know where in your community you can refer those patients to. And again, remembering that sometimes there can be some reimbursement there if you sign off on that prescription activator justification letter. And then the pole fitting in lesson, again, trying to make sure that you've got an affiliation with someone who can do that if it's not going to be you. And again, certainly here in Halifax, again, we can do that. And then we've got our virtual service through the Club Z Fitness program. And even if you, honestly, if you're thinking about setting up something like this in your practice, but you're not sure if it would work, the Club Z Fitness program resource is there for anybody. And it might even just be sort of a stopgap while you get started. And then maybe eventually you collaborate a little bit more with a community partner you've got closer to home. And then again, remember that there are those DIY options there. Sorry, Deanna. You know me, I can talk.
Which is amazing.
Good. Okay, on to the next. Yeah, great. Okay, over to you.
No, that was excellent, Lauren. Just to say, everything here obviously is branded Get Up and Go Nova Scotia, as this was our first real official foray in this, format. But I think what's amazing about this is that through future collaborations, so if you're on this webinar or listening to it after the fact, and you are interested in bringing something like this to community, as Laura said, all of the key steps and the guide and the critical path to be able to execute are here. But we're certainly, as a company, very open to helping you customize something that will work within your specific neck of the woods. But Laura was, just instrumental in this project, and her expertise from a physical therapy perspective really allowed confidence for Dr. AJ. So what I love about this is just, again, the collaboration between family medicine and physio in such a way that everybody is really owning where their expertise lies. And so that's why this was so well executed. But all of the key project stakeholders are here. So if you have any specific questions, certainly you can reach out. As we've already mentioned, the polls are available via our website and also through Amazon, as well as many, many retail partners that we've already identified previously. But if you are looking to bring a Get Up and Go program to your community in your area, then please do connect with us, because we do have amazing local distributors, whether it's in Canada or in other parts of the world, that we can connect you with. So either info at Urban Polling, and you can mention this webinar, or myself directly if you would like, and we'll get you started with the information that you need. And I think just in general, just to continue to, connect with us, we have many, many great things that we feature via YouTube. I think even we have Dr. AJ speaking as one of our featured videos, as well as Laura. And then via social media, so Facebook, Instagram. We recently just launched a TikTok account, so that may be of interest to you, as well as LinkedIn. So do follow us, as we do try to share lots and lots of educational resources to help you enrich your program wherever you may happen to be. And we'll just end off here before we take any questions, just hear one of the other patients that was involved in the project. So just one moment here.
My name is Jorge Sadi. I live in Clayton Park West. Based on my experience, like a lot of people just keep walking and telling them that walk is good for them, but I try to introduce to them the Nordic pole or whatever pole that you're using, that it will help you a lot, because it will build some like muscle, or your 90% of your body will have the exercise instead of just your legs. Before the pandemic, I've been walking it all the time. We have a group that we have to walk in Point Pleasant Park. That's about once a week, every Saturday, something like that. My health is really, really not that good before I use the walking pole. It helps me a lot because before I'm really, my knee is not good and things like that. But after I use the Nordic pole, it's really good to use and help me to like catch fresh air on the on the trail, things like that. So I feel a lot better physically because it gave me a lot of energy. It's kind of addicted though because every time you see your walking pole, like the Nordic pole, you say, so probably I should use it.
So thank you, Laura. Thank you for joining us today and for collaborating. And to Dr. AJ, who couldn't be here, but obviously through the videos, it was conveyed her passion and her importance in the project. And now we do have a few minutes left here. If anybody does have any questions, what I'm going to try to do now is just stop share so that we can see if there are any questions. The best way, I see a few things coming into the chat. Okay, there's some product specific questions here. So how do you remove the tips? You should be able to just kind of pull them off. It depends on how long you've had your poles. They may be wedged on there quite well. I find if it's been after years of use and the tips haven't been changed, sometimes they're almost like sectioned in there. So you may have to give a little bit of force. What I find, oh, never used, but very tight. What I find then, Lynn, what I would do is if you have one of those rubber grips, sometimes it's a grip thing. I would take one of those, like you would use to sort of unscrew a can or something, and just kind of use it and then kind of give it a twist and allow it to come off that way. And that should give you some success. They are tightly on because we don't generally want them to fall off when you're walking. But you're right, you do have to be able to get them off. So for Ottawa, I see if you're looking for specific, no problem, Lynn. If you're looking for specific instructors in your area, we have some wonderful ones in the Ottawa region. I can think of 2 or 3 or 4 actually off the top of my head. But perhaps if you wouldn't mind, Francine, just sending an email to info@ with respect to this question, and what we can do is set you up with some contact info for people in your area who could definitely help you to get started. Any other questions? Oh, just a moment. Excellent, Louisa. So very happy to hear that you'd be interested in starting this in your area. I think the best thing to do would be, if you wouldn't mind, either reach out to myself directly or to the info@ and we can connect you to some of the resources and help you to, customize and things like this. So how to get started is really what you're needing. Super. Any questions for Laura? Okay. Lisbon, Spain. Is that right? Portugal. Is that where we are in the world? Just trying to think. In that neck of the woods, we don't have very many. Portugal, yes. No, I would say probably not. So if you're interested in taking our course and getting going there, then we could certainly speak to you about that. Again, for international opportunities, really outside of North America, if you can email me here, I'll just put my email into the chat as well, just so it's a bit easier to grab it. Then we're very happy to help you in that capacity. Any other questions or anything specifically for Laura and her involvement in the project, or anything for Dr. AJ that we could pass on specifically? Okay. Well, looks like the questions have stopped rolling in. So again, we really appreciate everybody participating, whether you're here joining us live or you're watching it after. All of these types of programs are really what has allowed us to impact health and mobility and improve people's lives. And so if you're passionate about that, I mean, assuming you are, that's why you're here. We're very, very happy to work with you to the best of our ability. Oh, sorry, there is one question for you here, Laura. Have you followed the patient?
Yes, I think just maybe have we followed the patients from the pilot, right, to see if they're still using them. So yes, I would say, you know, not every single one of them, but generally yes, and we know that they're still enjoying them. And our plan is probably I don't know how familiar you are with our weather here, but we'll probably wait until we hit sort of April, May, and then reach out to people and see if they've continued to use them indoors someplace through the course of the winter, which is certainly possible, and to give them a little nudge towards. Oh yes, you're in Ottawa. Sorry, to give them a little nudge towards getting them back out for the spring and getting going on their program again if they took that winter pause.
Great. Perfect.
Yeah.
Okay. Well, I think that's it then. So thank you again, Laura, for being here with us today. We really, really appreciate it. Thanks for everybody for joining. And there will be a follow-up email that comes out with the recording of this, as well as some of the resources on the Get Up and Go landing page. But again, those are all customized for Nova Scotia. So if it's something that you'd like to implement in your area, reach out and we can discuss how we can set up something similar for your area. Okay. Thank you again and enjoy the rest of your day and week. Bye-bye.